experience. About 2 months ago, I had a program where a physician was chairing the session. It was about diabetic camp and related educational program. Introduction, you mentioned that Dr. Rao unnecessarily going to talk about sex. You are all old people and diabetic. You don't worry and bother about this particular problem. So this is the type of attitude many physicians have, and I'm really happy that you brought out that particular issue very nicely.
Thank you, Dr. Rao. Yes, Dr. Sai Kumar.
Just wanted to ask one question and share on experience. How much the anti-cancer drugs can cause psychological problems in terms of developing a clinical disorders, one. Two, last week I had a patient, 50-year-old woman, underwent mastectomy about 3 years back and separated from the husband for about 6 years back, deprived of marital and sexual pleasure for quite a long time, but living in a family house, and where the house owner was considered to be a caretaker of the entire family of hers. And then that man suddenly asked her to vacate the house. This happened about a week back. In a week time, she suddenly reacted with acute paranoid reaction. Developed all sorts of delusion, blaming him, rejecting him with all sorts of all that. So I just would like to request you to reflect on this, that how much these psychological factors are influencing the deprivation of the sexual pleasure and other things.
Absolutely no doubt. As you know, sexual response is psychobiological. So what affects the psyche can definitely affect the functioning, the soma. So there is no doubt about that. As I mentioned, it is not only the anti-cancer treatment by depriving the necessary hormones and other side effects, but the entire strain of realizing that you almost bought a death warrant and you have only few more years to live, and the partner also worried that she may lose her loved one or his loved one. They will definitely affect the psychology and add on to that.
Thank you. Can we conclude or any more questions? Again, I think I need a big clap.